photograph and put it on the
اللي بيصور وينزل
سعيد لا تزعل
شيء بلا كده فيديو.
okay.
يقري فرجوره معرق.
Now, whenever you are examining the deep tendon reflexes, remember that the part of the body where the affected muscle or effector muscle is there, that has to be exposed properly. Because ideally, while performing the reflexes, you don't have to see that whether extension is going on or not, or flexion is there or not. Actually, you have to look that whether on applying stimulus the muscle is contracting or not. This is the basic idea. And you cannot do it until and unless the area is properly exposed. So that's why for the examination of these reflexes, first thing is that the effector area should be properly exposed. Number two, before striking with the hammer, try to locate the tendon properly, so that within first time or second time you will strike the tendon at proper place and you will get the proper result. Otherwise, if you are trying here and there and here and there many times, then the reflex will be lost. Adaptation will develop. So that's why there is no hurry. First, locate the tendon properly and then strike it properly so that you get the result first time or maybe the second time. Okay? Then again compare on both sides to check whether reflex is normal or abnormal or whatever. Right? Coming to the biceps tendon is deep. Therefore, you cannot strike the biceps tendon directly. So what you have to do, that use one of your hand and with the thumb, you put the thumb on the biceps tendon firmly. And with the rest of the fingers, support the elbow of the patient. And this forearm of the patient, it should rest against your forearm. Okay? You can do it in this position also, but in that case, your thumb will be in a very narrow area and difficult to stimulate it, hit it. Therefore, the better way is to support it against your forearm, put your thumb on the biceps tendon, with the rest of the fingers support from behind, and now strike on your thumb, like, okay?
Is that normal reflex?
Yeah. Very clear. This movement is like so. Strike on your thumb, and the thumb should be firmly against the biceps tendon, like okay. So this is how to examine the biceps. Second way, for the triceps, slightly support the elbow joint from behind, and then above this joint stimulate the tricep. Very clear. Okay. Proper stimulation of the tendon, reflex will be there, but proper stimulation. Then thirdly, for the brachioradialis, this is the wrist joint, so above here, stimulate like this. Difficult, this brachioradialis is a difficult reflex. With the practice you can do it. Maybe the location. Yeah. Just relax. Like this. Yes. So biceps, triceps and brachioradius. Okay? Then come to the lower limb. There are many ways to examine the patellar reflex. In this position also. Very clear. Or another way is that pass your hand below the knee joint and rest is on the other. Now you can see that it is lifted above the ground, so more easy it becomes. And now you can strike.
Ankle.
Second one here is the ankle reflex. For the ankle reflex, flex at the knee joint like this, and you have to make this tendocalcaneus a bit in an stretching position. So with fingers of your one hand, stretch this area like this. And now strike here. You can see this part moving. Very clear. Very clear. Similarly here, this area.
There is no reflex.
Yeah, like. Yeah, very clear. Not only this area will move, but you will feel pressure when this area is moving forward. So, knee reflex, ankle reflex, supinator reflex, for clonus, the way is that hold from the knee joint and one from the hand like this, and then the ankle region you have to stimulate repeatedly. How? Like this. If the clonus is there, it will show you a jerking vibratory movement. But no. Like this. Okay? Then the jaw reflex. Jaw reflex need a bit practice because you have to put your thumb or the index finger either like this or like this and strike on your thumb or finger, but it need practice, otherwise maybe you hit on the lip of the patient. So carefully, slightly open your mouth, slightly. No, open the mouth. No. The reflex will be when the muscle contracts, the mouth will close. خلاص. Slide. Now, suppose that you are trying, but you are not getting the response. In that case, you have to make a reinforcement process. It is also known as Jendrowski's maneuver. Jendrowski's. The purpose is twofold. One fold is that when you ask the patient to do this maneuver, his attention will divert towards this process and away from this procedure. So, a bit relax. And number two, this process will increase the tone of all the muscles of the body. And increase in tone means increase reflex response. How to do it? If you are examining the lower limbs, then ask the patient to take both his hand fingers and engage the fingers in between like this. And then pull them away from one another forcefully, and at the same time clench his teeth like this. When he will do this, the overall tone will be so much increased that the reflex will be there. But this method can be done only if you are using the lower limb. What you can do if you are using the upper limb, bicep, reflex or tricep? In that case, using only one hand, which is free. For example, left hand is free, ask him to make a strong fist like this and clench the teeth. If right hand free, by right hand like this and clenching the teeth. It will also do that.
Reflex absent, normal?
Huh?
If the reflex absent.
No, the reflex normally in a normal person it will not be absent because of some abnormality, but usually they are absent because maybe the patient is less sensitive or the patient is tense. So when he is focusing, concentrating directly on what you are doing, then the reflex, the response will not take place. That's why. Otherwise not. So this method will relieve those stresses and the muscles get relaxed, more tone, and you will get the response. Secondly, the reflex examination not necessarily required the patient to lie down. You can check all the reflexes in sitting position as well, like biceps, also in this, with the sitting position. You can check very easily. Like this. Very clear. Similarly, for triceps, support the hand here and do the tricep like. Or you can put it like this and do it like this. It's similarly supinator. You can do it like this. Very clear. So in the sitting position also this for the knee reflex in sitting, make him hanging and you can strike. Very clear. Or you can sit down in front of him and you can strike. Okay? Clear?
Thank you so much.